Hello and welcome to DIY Therapy. As always, we start with our disclaimer. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. My name is Will. With me as always is Andy. Morning!
Good morning. How are we doing?
Pretty good. Now that the sickness in my household seems to have run through all the people it will run through, I don't want to...
You better not jinx yourself.
I know.
Knock on some wood. I'm not a superstitious man, but I'll tell you what. With being in a house that has had the flu for 14 straight days like you better make sure.
They're not the good kind of flu? If there's a good kind of flu, I don't know what it is, but it's the stomach flu where everything is...
Everywhere?
Yes.
Yeah, you better cover all your bases, though.
Yes.
Knock on some wood.
All right. We're not doing a topic today, per se. We're going to do something a little bit different. Mm-hmm. You wrote a book.
I did.
It's the Rehab Cookbook, Low Back Pain, and how to treat thyself. Well, it's not really thyself, but that's a lot more fun for me to say.
Yeah, this is... essentially a shameless plug? Is that what this is?
Well, I'm just going to ask you about it because I haven't read it.
You know a lot of my philosophies, though.
Yes, but I still haven't read it.
It's because you don't know how to read.
Don't judge me. All right. So, first of all, why did you do this? Why did you write the book?
Yeah, that's a good question. I wrote the book... for a couple different reasons. One is because, just from kind of a global level, I think that there's a significant knowledge gap that actually exists between medicine specifically, the actual clinicians, the research, and the empirical data, okay, and then what the actual patient knows. So it really was based upon trying to fill that gap. Because that's the gap that, in a lot of ways, I think can really make the difference between people getting better and getting worse.
So basically, not necessarily not like a education as in you go to school kind of gap, but just more of a us educating a patient kind of gap.
Yeah, well, and what they need to know to get themselves better.
Okay.
And so all of us, you can probably attest to this. We all, as clinicians, have this great knowledge, but not all of us are really great communicators in it. Yeah. And the transfer of knowledge sometimes is lacking. And there are a lot of different reasons why this happens. Sometimes it's just time oriented. You don't have enough time in the clinic. And this is at all levels of medicine, by the way, whether it's your MD, whether it's a physician's assistant, whether, you're going in for a dermatology appointment, whatever it is. Specifically with therapy, that's obviously what the scope is here. But, there's the patient's education level, the provider's patient's level with, the actual patient themselves, pressures from administration to actually bill versus educate. And then, just sometimes providers, aren't good and just don't have the communication skills available. So, it's about trying to bridge that gap. So I think some clinicians can actually read this and maybe get some knowledge out of this, but I think also it's more geared towards the individual who wants to try to treat themselves or wants to use this as a tool for some while they're in therapy to help kind of continue to understand what's going on. And then the other thing that I think is because of this, I think people a lot of times. So the other reason I wanted to write this book is because people have a lot of beliefs and emotions that kind of automatically set themselves up for failure when they come into therapy or when they try to give themselves their own treatment or try to treat on them by themselves. And so we wanted to kind of demythify some of those things. And then lastly, I think people just kind of lack some of the fundamental knowledge, low-level knowledge, not saying like really scary, technical stuff that is needed, but they lack some of that fundamental knowledge that can help facilitate more healing. Like if you understand what's going on with your body, sometimes it gives you more insight into how to actually treat yourself. And as you know, DIY therapy, one of our goals, you knew I was writing this book, and so we started making this podcast based upon that because, we thought it was a good idea to kind of continue to fill that education gap that exists for individuals, because there are a lot of simple concepts that maybe aren't transferred from an education standpoint to the patient in the clinic that are in this book. And then there's also a lot of concepts that people can use without going to therapy. So it's not to replace therapy. It's an adjunct type of tool, but it's also, if you're especially with some chronic pain issues and low level pain issues, I think there's some really good content in here to help you manage your symptoms a little bit better.
What would you say the major themes of the book are?
Boy, you sound like you're just reading these things off. You're a great interviewer.
I didn't go to evil journalistic school for nothing.
Oh yeah, that's right. I forgot you had that degree.
Yeah, evil journalistic school. Wait, yeah.
Yeah. So, I think I don't know. This is kind of probably a long-winded answer. The major themes.
Wait. You're going to do a long-winded answer?
I know, right? For those of you who have heard our podcast in the past, certainly I am very capable of just going on very, very long tangents, and this will probably be one of them. But it kind of goes back to some of the reasons why I wanted to try to write this book, and really it starts with kind of my own self-discovery as a clinician. And a lot of it was about me challenging myself with some of the fundamental biases that I've had as a clinician, things that were specifically taught to me when I was in clinical therapy school, that were really beliefs that I had and biases that I had. For those of you that don't know, therapy always goes through these waves. And when I was in school, the big thing, this was in the mid-2000s, the big thing at that point was really manual therapy techniques. It was really about biomechanics.
Okay, wait, explain biomechanics just so they know.
Biomechanics is essentially how the joints, muscles, bones, ligaments, tendons, all those things move in relationship to one another in the nervous system and how that all interacts. And so the idea back in the 2000s was really about, okay, they almost treated us like technicians back then, because essentially what happened was, we wanted to diagnose a specific problem and then we wanted to fix it, just like a mechanic, right? And that's great, and that's grand, but that's just not really the way that a lot of the stuff works. If that were the case, if you were to just fix the underlying problem, then pretty much there's certain amounts of healing time that occur for every tissue. So if you have a sprain, if you have a meniscal tear, if you have a low back disc issue, there's healing times that we have for this. So theoretically, every healing time, once you hit that healing time, you should heal, right?
Right.
And theoretically, every surgery for that matter, when they go in and they actually quote unquote, fix the mechanical problem, it should heal, right? But we all know that pain, dysfunctions, chronic pain is a perfect example of something that, lasts way beyond those healing times. And then, we also know that and have met or have experienced individuals that have had surgery that were not successful, And so that's really where a lot of my my basic fundamental values and fundamental beliefs as a therapist started to become challenged, because I became increasingly frustrated in the fact that I wasn't able to fix these things from a mechanical standpoint, and I kept asking myself, why? Why aren't these people getting better? Why aren't, if I fix this issue, if I mobilize this, if I did that, why aren't these people getting better? And so that was kind of my own personal experience with this. It's kind of it's interesting because this is, and I don't believe we're doing anything specifically revolutionary in this book. All the principles are based upon empirical data that we have. It's all based upon research. It's not opinion. What I do believe is that we're teaching this differently, and we'll get to that, because I truly believe that, I as as a PT, have turned more into an educator versus an actual physical therapist. But, we started to really write this book to try to teach, okay? And it really came down to when this was about 4 or 5 years ago, the president of the company that I worked for at the time came up to me and he said, "Andy, I'm starting to notice some trends in our outcome studies." And I said, oh yeah? These aren't usually good conversations to have with people. And for those of you that don't know what outcome studies are essentially when they're tools that we use to help us define whether or not we're consistently making patients better. It's kind of a self-check, and it was really important at the time about 4 or 5 years ago, because the idea was that if you could make people better quicker with less visits, less units charged, you would actually get reimbursed more. So you'd become more efficient with your reimbursement, take in more patients, and make more money. So the president was really, really interested in terms of what I was doing at the time. And I was actually kind of embarrassed because I would say to the effect of, I said to the effect of, I am not really doing a lot. I'm talking with my patients, I'm having discussions, I'm problem solving, I'm getting to know them in terms of what they need personally, but I'm not doing a lot of hands-on stuff like I used to. Hands-on stuff would be considered like manual therapy techniques.
Like massage
mobilizations, joint manipulations, adjustments, things like that. I wasn't doing a lot of that. I wasn't even prescribing a ton of exercises. I was actually I was oversimplifying everything. Well, I shouldn't say oversimplifying, because basically he told me that, you're in the last 6 months, your outcome measures are about 20% better than our second best clinician. And it was this validation all of a sudden to me that, okay, I am doing something a little bit different, at least in the area. And so he goes, well, can I just sit in and listen to an evaluation? So I said, sure, you go ahead. You can sit in. So we got that all set up. He came in, he sat in. And his background was actually like a clinical psychologist, which is interesting enough. So he does have some patient care background. And so he, after I dismissed the patient and they left, and he came up to me and he goes, "I get it." I go, "Okay, good, because I don't. Share with me what is it that I'm doing, because I don't know what I'm doing." And he goes, "You have stopped treating patients. You're teaching patients." And I was like, "Yes, I am. You're right." But I had never really thought about it that way, right? Like, I was actually finally teaching patients. I was helping them learn how to evaluate themselves on a minute-to-minute, hour-to-hour, day-to-day basis, week-to-week basis. And I was teaching them the skills to recognize what symptoms were important, what symptoms were not important. And I was teaching them, how to do these things on a regular basis, and people felt great, even if we didn't do a ton of stuff that first day, just because they had the confidence to move forward, that they had a plan, and we were giving them tools and a blueprint to treat themselves. And, the next thing that was kind of set out of his mouth, which has led me to this point, is, okay, how do we reproduce it? How do we teach this to others, and how do we reproduce this? And so that kind of led me to the question, okay, well, and so I began writing this book a long while ago, and part of it's been a long journey, but part of it is because it's been there's been many iterations already of it, and I really wanted to get it right, and I'm sure there's going to be more iterations as we move forward and we get more feedback from other people, but it led me to believe, okay, what is it that I want to put this book around? What are the central themes that I want to put this book around? And so it really came down to probably 1, 2, 3 different fundamental things that I try to do on each and every evaluation. So essentially, I kind of wrote it as if, what are the 3 most important things that I want every patient to walk out the door with on my initial evaluation? Okay, if I were to see a patient come in and I talk to them for an hour, what are those 3 things that I want them to know? Okay, which is really ironic, because the first thing really comes down to, self-discovery. Okay, so one of the big themes of this book, it was a long introduction to get to the first theme, right? Talk about rambling. So one of the first themes of this book is really having a better understanding of your beliefs and attitudes. Okay. Every patient that walks through the door has a certain belief, has a certain attitude, and we kind of can lump these things together, even though they're a little bit different. And these things are both positive and negative, and these things are going to influence really what it is, how we think about our injury, right? Like there's certain feelings that we have about our injury, whether we were a victim in the injury, whether we were the fault of it, whether we what's actually going on with the injury. Do we think we're damaged? Do we think it's just a simple, non-discrete issue? How long has it been going on is going to change some of those attitudes and beliefs. But essentially, these things are what we would consider like biases, right? And we all have personal biases that we develop. And part of what we really want to do is we want to try to change those biases, okay? Because unfortunately, most people's biases when they walk through the door, like their initial ideas of what's going on with their problem and what role they play in their problem, are wrong. And that's just me being transparent in it. Maybe a better way to say is they're faulty, but they're certainly not. They're not the right thought processes that set us up for success as we're going to heal. So the first thing that I try to address with people and challenge people when they come through the door is how do we identify some of these belief systems that we have? Are they on target? Are they not on target? And are they actually hindering some of our healing just by not setting our mind, our body up for success? And so it's a little ironic because, I got to here because I challenged my own biases by getting out of this mechanical process and getting more into this pain science, which is something that we can maybe touch upon, because I think we were planning on doing maybe 2 or 3 other.
Yeah, we'll maybe make this a little bit of a series. Kind of we'll do however many it takes, but maybe 3 or 4.
Yeah, depending on how much I ramble.
It might take 7. 7.
Yeah, 15. Get 2 listeners.
Yeah, who's got the time to listen to all this?
Nobody.
And I think you're right. I've always, me personally, whenever I'm dealing with a patient, I always explain why we're doing a thing, even if it's something as simple as just a small exercise, just because you're more apt to, if you understand why you're doing a thing, you're more apt to continue to do the thing.
Yeah.
Knowledge is literal power in this, because I remember when I was in Boy Scouts, we were playing capture the flag, and I ran after somebody and stepped in a hole and screwed up my lower back. And I remember my mom taking me to a physical therapist and telling me, the therapist told me to, do a couple of stretches, and never explained to either her or me, which me wouldn't have mattered because I wasn't old enough to remember or know, but why you would do the thing. Just do these things, and then, shuffled me out the door. And then, if you understand why you do a thing, you will continue to do the thing. Even if you don't see immediate responses or immediate progression.
Yeah. I couldn't agree with you wholeheartedly, or more. More.
Get there. Mm-hmm.
Yep. I speak well. So I think you've hit a couple of good points there. Compliance, I think, is if your knowledge equals compliance. And at the end of the day, if you're not doing what you're supposed to be doing, or what is going to be something that sets you up for success consistently, then you're never going to get to where you want to be, especially if you have reached the point where you're not just in acute pain, you've gone into this episodic pain that comes and goes, or chronic long-standing pain that is both up and down and variable in its nature. So, and so the other reason that I wanted to write the book, so one of the other main themes is that and you I'm sure you can attest to this, but when you talk to a patient the first time and you ask them, okay, what's going on? The truth of the matter is they have no idea. Like they have no idea what what is actually going on from a cause and effect relationship. And I'm not talking about like mechanically, like biomechanics. That's not what I'm talking about. I'm talking about like they really don't know what is, specifically like a driver of their pain, like what actually brings on their symptoms and what activity that is associated with, right? So, one of the things that I wanted to do was really go through and make sure that people had a better understanding. Like on my initial eval, I want to make sure people have a very good understanding that our goal is to get into the weeds of this. Like some people can say, yeah, I hurt a little bit later in the afternoon. I feel better in the evening and I feel worse in the morning. Okay, why? Okay, what were you doing? What were you not doing? Okay. So the idea is that we're trying to associate different activities with what is actually making our pain change. So, the majority of pain, okay, whether you are chronic pain and you have pain every day, the majority of pain is, essentially variable pain, meaning that it gets better or worse throughout the day, like it changes. And so when we start talking about, our pain going from a 2 out of 10 pain all the way up to a 7 out of 10 pain, then going back down to a 4 out of 10 pain, there are things throughout our day that change this, okay? And so most people have no idea what those things are. Maybe generally speaking, they get it. Like, okay, yeah, I'm sitting.
There would be big things,
why?
I would think. There are big things that they would know that bother them, like standing for, but there are other smaller things that they just are not paying attention to that make it worse or better.
Absolutely, yeah. And so this idea of trying to teach them this variable pain concept and really help them identify the things that make the pain worse, which would be like provocative activities or triggers, and then also on the flip side of that, helping them identify the essentially the healers, the things that make people feel better. And so, as I said, most people don't know these things, and that's really where a lot of this lies. Because if you don't know what it is you're doing that's causing your pain, if you don't know what you're doing that's making you feel better, and you think it's all random, you're never going to get any success, okay? Because it's not random, okay? I mean, sometimes in life, yes, God does just strike you down and say, you shall have pain. I mean, that does happen, but that's not the majority of cases that walk through the door. That's not the vast majority. I mean, the vast majority of pain is where it is literally you're doing this, maybe the pain doesn't come on right away, but 20, 30, 40 minutes later, an hour later, something like that, the symptoms start to come on. So it's really about identifying those things and helping to teach you how to do that. And what I've learned here is that patients either they can't do it, they don't want to do it, or they don't have the skill for it, or it never even dawned upon them to do it. But what's important here is that it is a skill that can be learned, okay? And I think that's the big thing is it is a skill. Like right now, I consider myself fairly good at it. Most people that walk through the door are crummy at it, but it's learned, and if you practice it and if you're consistent with it, you get a lot better with it. And when we start to get a lot better with it, guess what ends up happening? We can start to actually predict our symptoms. It actually gives us some predictive value to where we know how we're going to feel here and there based upon what we're doing. And that in and of itself allows us to manage our pain better. Okay, so by understanding cause and effect relationship, it allows us to have this predictive value that we can now move forward with and say, okay, well, I'm going to do this. I know I'm going to hurt, but I'm going to do this exercise right afterwards because I know that's going to make me feel better. Okay, yep. Or you can start to take a proactive stance where you're doing an exercise, a healer exercise that you do repetitively, so that you get ahead of the pain and you stay ahead of the pain. So there's a lot of different strategies once you start to identify these things that help us a lot and allow us to manage our symptoms better. And let me be perfectly clear. When I say manage our symptoms better, I don't mean that it's going to fix your problem. That's not what this is about. Some people will, yes, their problems will be fixed. Absolutely. Some people will be where, hey, you get 20% better and that's it. And some people will be 99% better. Okay, you're going to fall someplace on that spectrum. And then the last piece is that some people will actually, unfortunately, are surgical candidates. So this is not the end-all, be-all. This is not what we're promising in this book. I need to make that perfectly clear. But this is a tool that can help you manage a lot of people. I mean, I'm talking like they say true surgical candidates are about between 5 and 7% for low back pain. Okay. And that's just low back pain. This can be applied to other body parts, but from a low back pain standpoint. So you're talking about 93% of the population can actually get some relief in this. Again, where it's at, I'm not sure, but I think if you apply it and be consistent with it, in my experience, people get better when they're consistent with it. So, you know, I think that's kind of one of the last things that I've really I think that's one of the last themes that I've used. I don't know if I missed any in there. I rambled quite a bit. So
I think you summed it up pretty well.
Did I?
I mean,
was it all over the place?
I wouldn't say summed it up, because summed it up usually is concise. But I think
we all have our strengths and weaknesses. God knows mine isn't keeping things short.
Well, I have more questions for you, but I think we'll just hold off there, and we'll revisit this again next week, and we'll ask some more questions. I'll put a link to the book in the show notes if anyone is interested. Do you have anything else to add?
Yeah, well, I would just say that. Listen, I'm not a writer. We haven't gone out and hired a ghostwriter to help some of this stuff. So, take it for what it's worth. I am very open to talking with people regarding how we can communicate this better through the writing. I'm very open with, sending emails back and forth, or even getting on a call and talking with people who purchase it. I want to get this right. I mean, I think that's the big thing, because I think as I said before, I don't think there's anything, revolutionary in terms of like we're not reinventing anything here, but I think there is a huge gap in the general population that don't understand these things, and I don't see a good medium right now that actually is serving this. And I think if we can do this right, and that's why I'm totally open to criticism, I think we can really make some positive impacts in a lot of people's lives, and so if you do go in, purchase something, the book from Amazon, I mean, it literally gets me like a cup of coffee after royalties and things like that, because Amazon is a beast in and of itself. So it's not like we're making a lot of money off of this, but I would really enjoy, you can contact us.
DIYtherapy206@gmail.com.
There you go. I'd love to hear your feedback so that the second edition, even this is the first formal edition. Like I said, we've had several iterations already, but the second edition, we hope to kind of take some of that feedback and continue to just mold it so that we're working with our audience.
Yeah.
So.
If there's any holes that somebody else notices, like they read it, there's bits that they don't understand, you can help clarify.
Absolutely. Yeah. Yep.
Because this is all about teaching.
That's it. Yeah. Knowledge transfer.
Just a little add-in that we thought about. If you are interested, we're looking at doing consultations with people. So to get in contact with us, like over Skype or something like that, to better educate you about questions you might have about the back pain book or anything like that, just email us at DIYtherapy206@gmail.com. This podcast was for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. Remember, treat yourself.